Hello everybody, my name is Michael Heuninckx, one of your TCRN instructors, and this is another video in my mini lecture series. Today we're going to be talking about the trauma triad of death. That triad includes hypothermia, metabolic acidosis, and coagulopathies. We're going to talk about hypothermia and how imperative it is to be making a spot in that triad of death there as one of the reasons that causes our patients to end up dying. So we want to prevent this by all means. Ways that we can do it at the bedside is after we expose our patients, as soon as that's done and we have our assessment findings, cover those patients up with warm blankets. We can close the trauma room doors. We can increase the temperature of the trauma room. Sometimes there is even heat lamps that can be turned on above these patients. Another thing that we need to do that happens all the time, and I cringe when I see it happening, is not giving these critically ill patients warmed fluids. Anytime that we are transfusing either crystalloid or blood products into these patients, any of those products need to be warmed before going into the patient. That blood just came out of a cooler and you're putting it into their vascular system, which you're going to dramatically decrease the temperature of that patient, giving them one of those findings there on the trauma triad of death. So by all means, do whatever you can to keep your trauma patients warm. I hope you found this information valuable, and we'll see you soon.